I think you know that it's important for postmenopause women to take calcium, vitamin D, and do weight-bearing exercise to prevent and decrease bone loss. But it's not so easy for women who don't like dairy, who don't tolerate milk products, and have a tough time getting other foods to get the calcium they need. And while the supplements are good and they help, a lot of women just don't do well with them. And it's not as if taking the right amount of calcium and vitamin D is going to prevent needing a medication at some point. It just decreases the risk. So here's the headline. A study just came out that eating 6 prunes a day, 6, works better than calcium and vitamin D when it comes to bone loss and protecting against hip fractures, which is great news. Great news for postmenopause women who are concerned about their bones and maybe also happen to have a little constipation. But just to be clear, while the prunes were more beneficial than calcium and vitamin D, they're not a substitute for women who are taking osteoporosis medications. But prunes can be a substitute for vitamin D and calcium. And while I'm on the topic of bone health, another study in a British medical journal showed that sticking to a vegetarian diet was linked to a higher risk of hip fracture in postmenopause women. Specifically, vegetarian women ages 35 to 69 saw a 33% higher risk for hip fracture than those who regularly ate meat. Pretty interesting since meat doesn't have calcium or vitamin D, but clearly is important for bone health.